patient comes to you and says, my Aura ring said I only got 10% REM sleep, or I want to know how to get more deep sleep, how do you advise them? Well, it starts by understanding the basics of sleep architecture, and that is what we are looking at in today's video. If you're a doctor or a therapist who wants to up-level your clinical sleep medicine knowledge, then go ahead and subscribe to this channel and also click the like button, because doing so feeds the YouTube algorithm so this information can get out to more people. This channel is all about practical clinical sleep medicine so that you can better serve your patients in your practice. I'm Dr. Nishi Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine. Every video is eligible for CME credits. Watch this video to the end and then go into the video description to click the link to get your CME credit. The way that I like to think about sleep architecture is that it's like a symphony. You've got all these different bits and pieces that come together to make this beautiful composition. Sleep is very melodic, it's very rhythmic, and looking at a sleep study, looking at a patient's brainwaves is very much like looking at a symphony orchestra in action. So I want you to keep this analogy in mind as we look at the basics of sleep architecture. Let's start by looking at stage 1 non-REM sleep. Stage 1 non-REM sleep comprises about 5% of an adult's total sleep architecture. The sleep architecture we're talking about today is for the adult patient. Pediatrics, young children, babies, they have a different sleep architecture. So we're talking about adults. Now, stage 1 is like your prelude in the symphony. It's like the opening notes of your symphony. It's a gentle and delicate introduction as we transition from wakefulness into sleep. This is the lightest stage of sleep. It's where everything starts to slow down. The heart rate, the respiratory rate, eye movements, the EEG starts to slow, muscles start to relax. You might get a little bit of muscle twitching, which is normal. So this is the transitional stage from wakefulness into sleep. Next, we have stage 2 sleep. So you can think of this like your overture. This is where the tempo starts to pick up. We start to get sleep spindles and K complexes, which are like the beginning of the symphony. So these are like musical notes that are indicating the beginning of the symphony as we kind of get into the melody and the tempo. And so what's happening here is we're progressing into deeper stages of sleep. So again, we see K complexes and sleep spindles, which are thought to have multiple functions, including memory consolidation and also maintenance of sleep. Stage 2 non-REM sleep is also considered a light stage of sleep. We get more slowing of the heart rate, of the respiratory rate, more slowing of the EEG, more relaxation of the muscles, and then the core body temperature continues to decrease. Stage 2 sleep comprises about 50% of our total sleep architecture. If information like this is helpful for you, then I invite you to grab my free sleep mini course called Sleep Medicine Pearls for Outpatient Physicians. It's filled with lots of practical tips and tools to use in your clinical practice. The link is underneath this video in the video description, or you can go to intrabalance.com/doctors to get a copy of the free course. Let's look at stage 3 sleep. This is deep sleep. Deep sleep is often mischaracterized as REM sleep. These are different stages. So when we're talking about deep sleep, we're talking about stage 3 slow wave sleep, and this comprises about 20% of an adult's total sleep architecture. We can think of this as the part of the symphony that includes harmonies. So deep sleep is very harmonious. We get these profound harmonies with a symphony. This represents the foundation and the depth of the composition of the piece of music. So this is our deep sleep, and we get these beautiful, large, deep delta waves during slow wave stage 3 sleep. This is where everything is at its slowest. The heart rate is slowest, the respiratory rate, the EEG, the delta waves like I just mentioned. And stage 3 sleep is important for hormone regulation, for growth. This is where we get synchronization of the brain waves pushing out toxins out of the lymphatic system, clearing out amyloid, beta protein, and things like this during stage 3 deep sleep. We also get repair of the tissues and the immune system during this stage as well. And then lastly, we've got REM sleep. So those first 3 stages are non-REM, then we've got REM or rapid eye movement sleep. We can think of REM sleep as our crescendo in the symphony. This is where the intensity starts to build up. We get vivid dreams during REM sleep. REM sleep is very similar physiologically to being awake. It's like a big, grand musical narrative during this stage. Now, we do dream in other stages of sleep, but vivid dreams that we remember that have more complex storylines signs generally take place during REM sleep. REM sleep is important for cognitive processing and emotional regulation. As the name implies, during this stage of sleep, we get rapid eye movements. We have an increase in heart rate, blood pressure, increase in EEG activity. And again, it's very similar to the physiology of wakefulness. During REM sleep, the body becomes paralyzed to prevent the acting out of dreams. And REM sleep comprises about 25% of an adult's total sleep architecture. Here's a representation of the different sleep stages across the night in this hypnogram. On average, an adult will go through about 3 to 5 REM cycles each night, and then each episode of REM gets longer as the night progresses. So you'll see here, this dark blue line, this bar, is representing REM sleep, stage REM. This is stage 1, stage 2. These ones at the bottom are stage 3 sleep. We get longer episodes of deep sleep in the first half of the night. Then as the night goes on, we get longer progressive episodes of REM sleep. You'll notice that sleep cycles through these different stages across the night. It's normal to have some brief awakenings throughout the night here. You see that represented here. Stage W is wake. So there's a little awakening here, there's an awakening here, and that's completely normal to have throughout the night. And you'll see that as we progress in this hypnogram, the person's coming out of stage 3, back into stage 2, then REM, back into stage 2, back into stage 3, and so on. There's this awakening, then they go back into stage 1 as they progress back into stages of sleep. And so you'll see that this cycles across the night. Now, what's really important is that going to bed and waking up at different times is going to cause disruption of the sleep architecture. So this is why, as physicians, we're always recommending to our patients to maintain a consistent sleep schedule as much as possible, to maintain a consistent wake time and then a consistent bedtime as well, because maintaining consistency in the sleep schedule is going to help preserve the sleep architecture. When patients go to bed too late, they're not allowing themselves to get this deep restorative sleep in the first half of the night. If they're waking up late some mornings and earlier other mornings, they're not allowing these stages of REM sleep to happen in the second half of their sleep cycle. Maintaining that consistent sleep schedule is going to help preserve sleep architecture. Here we are, a representation of the melodic sleep symphony across the night. And then the grand finale is the impact on overall well-being. A well-orchestrated sleep symphony is going to have a positive impact on overall health and vitality. Do you ever see patients with sleep issues in your clinical practice? Let me know in the comments below. I would love to hear the kinds of sleep issues that you are seeing showing up in your practice. And do you talk to your patients about sleep architecture? Drop me a note in the comments below. If you're a doctor or a therapist who wants to up-level your clinical sleep medicine knowledge, then go ahead and subscribe to this channel and also click the like button, because doing so feeds the YouTube algorithm so this information can get out to more people. This channel is all about practical clinical sleep medicine so that you can better serve your patients in your practice.